Welcome to another session of Ruminate with Hina. Today, we will be talking about the physical health of women and how important it is for them to be physically fit. Today, we will be talking to Dr. Fiza Taj Samad, practicing physiotherapist since more than 15 years, founder of Relief Physiotherapy and Wellness Clinic in Bangalore, a Pilates rehab and fitness instructor since 12 years, cupping therapist, women's health promoter, life coach, and a mother of 3 beautiful children. Welcome, Dr. Fiza. Thank you for being a part of health awareness creation on Ruminate.
Thank you so much for having me over, Hina.
Let me begin.
Can you hear me?
Yeah. Yes, I can hear you. So let me begin by asking you, what is the meaning of being physically fit? I mean, does it mean to run for 10 kilometers, or does it mean to be able to climb stairs, not take the lift? So what exactly is the meaning of being physically fit?
Okay. Let's start with the WHO definition of what is health. So basically, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease, right? That's the typical definition of what is health from WHO. Now, when it comes to physical health is basically the state of being free from any injury or any problems or any diseases, where you're able to conduct your activities of daily living on every single day basis in the way that you're able to carry off without any strain or without any aches and pains, where you're able to carry off even your professional needs, your physical needs that can be overcome, your professional needs are basically, and if you can do that in entire 24 hours of a day with good rest. Of course, there are some other parts of physical fitness also, which is the dental hygiene, your physical hygiene, and also the diet that you take in. Everything put together makes the physical health.
So tell me, why is physical activity important for any woman?
When somebody asked me that question, like, tell me why it's not important. Basically, our bodies are made to move. Forget women, everybody has to move, like from children to women to men. Every age group is being, is supposed to be moving. There's a very interesting video which I was watching just lately of a priest, a very well-known priest, who literally took into religion and he wanted to do something for God. And I think somebody motivated him to just keep his hand up high up like that. And for about 4 years now, he's had his hand just in this position. It is terribly, terribly painful to keep that hand in that position, first of all. And since there was zero activity for about so many years and so many months, now the hand is completely dead. There is zero blood supply and it is stiff. It is equivalent to being, non-active, which is a typical example saying that even if somebody has, are unable to move from the bed, what happens? Atrophy happens. There is loss of muscle mass. There is loss of, muscle girth in the body. Typically, what I'm trying to tell here is, if there is inability of, or if there is no physical activity, you will start losing your muscle and you will start having atrophy. So our bodies are made in such a way that you have to move. And if you do not move, then there is muscle wasting, there's loss of girth, there's loss of tone, and there is loss of strength. So beginning with that, you have to move. You have to move, and you have to move most of the times in the day. There are periods of rest which are also important as sleep and rest times. But then, since our bodies are made to move, physical health and physical activity or physical fitness becomes a very important part of our process. So in women, if I'm specifically, since we're talking about women today, if I have to start off with, basically, we all know this. Exercise actually improves memory and brain function. It aids in weight loss, as we all know. We've been reading it all over the place. We know it from the time we're children. We've been taught that physical activity or exercise helps in losing weight. It basically lowers blood pressure. It regularizes your hormonal changes, and it improves your quality of sleep. So on the days you exercise, or even if you resort to exercising, you will see that your actual sleep pattern has become a lot more, because your body requires the rest after a period of exercise. Then see, women also, as we get into puberty, we carry a lot of weight around our waist. And that's something very new to girls, or women who just kind of started to put on weight. And this is the exact area we start depositing. And that again leads to a lot of cardiovascular changes, for which again exercising or being physically fit is very important. Now, again, that can of course be measured by what we call as the hip to waist ratio, that is WHR, waist hip ratio, which can be divided by waist divided by hip, and the ratio most of the time should be lesser than 0.89. That is, yet 0.80 would be ideal for women, where point 0.80 to 0.89 is yet okay. So that's one way, one very basic way we would determine, good health in women. Then of course it leads to mineralization of the bone. I'm sure you would have, in very early days in life, read that when you go to the moon, you have zero gravity, right? And what happens? You're floating, and because of which, you grow also taller. But then, since there is no weight bearing, you also lose that much bone mineral density. But thanks to gravity on Earth, we can actually move, we can walk, we can do so many things. And because of that weight bearing, we have a lot of mineralization of the bone. Whereas the calcium deposit or the, mineralization, as I said in very simple words, I wouldn't want to, make it complex, increases with weight bearing. So that's why also weight exercises are very, very good for women. It of course increases and boosts our morale, our confidence, and improves posture. They want.
Yes. Yes. So, what are the most common women's health issues?
Okay, before going to that, of course, we had, we have to speak a little about what is endorphins. Now, endorphins is something that is amazingly released by the body when you exercise. So I have to put in across that point, and I want to talk about endorphins a little bit and explain to you what endorphins really, or how they are released when you exercise. They're nothing but basic neurotransmitters that helps to make your body feel very, very good. So that is immediately released when compared to dopamine. Dopamine is another hormone or a neurotransmitter that is generally released slower when compared to an endorphin. Now, how are these endorphins released? Of course, our good old chocolates. We love chocolates, right? As women, men, kids. I'm an ardent fan and lover of chocolate myself. So if I just want to alleviate my mood, sometimes I just pick up, a chocolate and eat it. But I also get the same effect when I exercise. So when you exercise, your actual brain is releasing these neurotransmitters, which are telling your brain receptors to make you feel good, to make you get released of pain. So imagine even if you've fallen down, say there's a little injury that is there in your body, immediately there is some amount of endorphin release, which is telling the body to kind of start healing or to reduce the perception of pain. So since exercise immediately gives you that gratification of endorphins and dopamine, it is so much more important for we women to exercise, because our body undergoes so many changes in so many phases of life. Yes, and now I'll go to your question. Right. See, the women's health basically, you can just say that women's, life cycle can be divided into 5 parts, right? So one is infancy. You can start with infancy, and then there is puberty, and then there is adolescence, and then there is pregnancy or childbirth time, and post that you will also have something called as the climacteric period, or the premenopausal postmenopausal period. That is the thing. So basically it divides into so many places. Now during infancy, what is it that you look at? In infancy, you look at taking care of the child, making sure that the movement is right, the milestones are perfect till they become toddlers, the speech is fine. In physiotherapy, we see that if there is delayed in speech, if there is delay in milestones, we look at catering to those needs. And we again go back to making the child physically fit, so that there is mental, social, emotional, and stability in all forms, or in all aspects of the growth of the child. Now, in pre-menarche, or what we call as pre-puberty, there is growth happening in a child. The bones are not yet fused, and at that point of time, children have to play. Children have to play outdoors. They have to play good contact sports, like physical sports. Could be running, could be gymnastics. Females like gymnastics a lot, so that's something that they can take up, or anything that can make a child physically active, which I think is being robbed off in today's times because of COVID and staying at home and working from home, schooling from home. So that's something that might lead to obesity in children, that is leading to premature diabetes, cardiovascular issues, and obesity. Of course, is one of the major precursors of being at home. That's one. Next, if we go to the puberty stage, now there's so much of cocktail of hormones, going up and down in puberty. I mean, all of us have gone through it. So again, physical activity at that point of time is extremely important. So that is when there are slow changes in your hip waist ratio starting, and then there is growth related changes. You start to have mood swings, and then your skin changes are there. So you want to look pretty. You're trying to make a place of your or an image of your own in the society. You don't know whether to be a rebel, to say no, or to just listen and be the puppet of your parent, or or a guardian. So there are a lot of things that are going on at that point of time. So again, exercise really helps to bring everything in place. On the days that you make your child or your daughter exercise or even take up, and I feel that is the perfect time to actually introduce exercise to a child, because now they're not a child nor are they an adult, but now it's when they become they take up things or they make things their way of life. So I, as a child, was introduced by my mom to this very nice yoga book, Yoga by Richard Hittelmans. So that honestly really did change my life, and I took up the profession that I have today. And it helped me pick up the essence of what exercise can actually do to your body. It was all about yoga and yogasanas. And since I was introduced really early, I would definitely recommend all of us to, motivate all our youngsters to take up exercises at a very early age. So there's plenty of things that you can do. You can do Pilates, if they like to do Zumba, let them do dance, let them do anything. Yoga and meditation, if you can, introduce them to, nothing like it. It's just a beautiful form of workout for girls at that age. And of course, if you want to, them, if they like to be a lot more active, energetic, and want to run around, then dance and Zumba is another option. So that was the puberty part of it. Now coming to the puberty part of it, I would also want to enlighten that, see, when you get your periods, even as adults now, not generally during puberty, that time you don't have the PMS, but after birth of children, or even as you grow a little older, you see that these PMS or the sugar cravings come in. So why does that happen? Basically, there is a drop in the hormone. Okay? We have two hormones majorly in women, that progesterone and the estrogen. Now, since the progesterone drops, then there is a rise in estrogen, of course. When that happens, that causes a lower blood sugar, and we feel like we crave for sugar. So that is the time when I would suggest that you could probably look at having high uh, carbs diet or stuff like that to curb those sugar craving. And PMS is normal. It is also told that exercise actually helps in reducing your PMS. So that is about the puberty and menstrual phase. Then again, I don't know. There's so many more phases like in women's life. Right? Then you go to pregnancy. Pregnancy, post-pregnancy, one of the most important events in a woman's life, because when you get pregnant, then your abdomen is actually trying to accommodate. So your uterus is growing 100 to 500 times more, which is just this size, but it has to literally accommodate a fetus. So which means your abdominal cavity is getting stretched, and at the same time the muscles are getting stretched to accommodate the growing fetus. Now when that happens, and when the fetus is out of your body, what happens? Obviously, anything that is stretched and recoiled, stretched up to 500 times, even a rubber band, if you see, becomes loose, right? That is one very, very, very important time when you need to exercise. So antenatal exercises, prenatal exercises, postnatal exercises play a very important role. So it's extremely important that you get, if you, I mean, of course, you have to have a tab, or get a go ahead or a green signal from your gynecologist. And if they are, take up to exercising. You can do simple workouts like Kegels during your pregnancy, which is very, very important. And you can do simple exercise of the abdomen. You can do your squats, lunges, so many things that you can do. During pregnancy, post pregnancy also, say if it's a normal delivery, I started exercising the day I delivered my baby. So because I had the knowledge of it, And yes, we do have physiotherapists who can come and talk to you about exercising, and that's how early you can actually start exercising. Literally, the moment you deliver, you can start exercising. So, but yes, for C-section, we do say leave it for 4 weeks, and then let the healing happen, and then we start 4 to 6 weeks later with the help of your gynecologist. Once you give you're given a green signal, we can start that. And when it comes to when it comes to pregnancy and post-pregnancy, two main topics that I would like to touch upon is diastasis recti, and next thing is urinary incontinence. Very, very important things where a lot of us ignore, and we just don't want to talk about it because it's shameful for us. We feel that the abdomen is just bulging out and we have no reason why, and we just blame it कि हाँ कपड़ा नहीं बांधा था इसीलिए टाइट नहीं बांधा था साड़ी नहीं बांधी थी. So how much ever you actually try to externally fix the muscles, it really does not do that much. Maybe the organs go back in place. I'm not against doing the corset technique, but what I definitely say is look out for something called as diastasis recti. It is nothing but a slight gap between there is a line called as the linea alba, okay, and there is a gap that is created between the two muscles, the two linear muscles called as the rectus muscles. So now, if I have to say rectus muscles, I would say uh, the uh, the six-pack abs that you see in men and women. Yeah, so that's that. I can show you a picture. So that gap is generally created to accommodate the fetus. Now, once that gap is reduced, I mean, that gap does not get reduced for a good 1 to 2 years post-pregnancy because you're either feeding and there's the relaxin hormone constantly being produced in your body. So it's important to see a physiotherapist physically. Go get yourself checked for your abs. Yeah, go get yourself checked and get it corrected or rectified, because otherwise it will lead to a lot of issues like hernias and prolapses. You could have an your rectal prolapse or uterine prolapse. Your grandmothers often never even understood the importance of these kind of exercise. They thought work was exercise. But I think most of our grandmothers, including mine, I remember when I was a child saying that she had a rectal, prolapse, and then they have leaks of urine when they're coughing and sneezing. You don't have to live with those issues. You have to openly come up and talk about them to your physical therapist and get them treated. So this is what I'm talking about. If you can see, this is the rectus abdominis. Yeah. So this is the linea alba, or that the place where both the muscles, the right and the left muscles join. Now these open up, and if there is a gap of 2 fingers in your abdomen, above the navel and below the navel, then that is when you know that you have diastasis recti. Don't try to just do it at home because sometimes you can go wrong. Always take help of a close by physiotherapist or a gynecologist if you're going for an opinion. There are many exercises available, and we can help you at our best level. I've had 3 children, normal pregnancies, and I don't have a diastasis recti because I've been constantly exercising. And I am an example for myself and for others whom I teach, saying that it is possible to deliver and yet go back to your pre-pregnancy state and go back to having no complications. Of course, the body does not go back to 100% of being, stretched and then gone back, but then you can achieve that 80 to 90. And you don't have to live with those, extra pads being worn for cough or sneezing, or being vulnerable to back pains. Another major issue is if your abs are very weak, you go back to having back pains, knee pains, the posture becomes stooped. So things like that. And of course, even during adolescence, one thing we've noticed very clearly with children, since there is growing breast tissue, children try to stoop. So that's something that we really want all the parents to be aware of, to go to a close by therapist or go to a close by person who can help you with exercising and rectifying this posture of your child, so the head, neck, shoulders are taken care of. Of course, 10th grade onwards, you have a lot of issues where the children are constantly bending and writing, a lot of strain coming to the neck. So those issues are also something that we do. But generally, if you're having a good physically fit child, whom you are making sure that you're giving enough time to the child or giving enough importance to just not studies or the other aspects of growth, but also to physical fitness, then you don't have to worry about these issues. So, and then as I said, there is a climatrix period, which is between like say 40 to yeah, around 40 to 60 years of age. So that is the age which is called as the climactrix period. Now that is when your premenopausal symptoms might start as early as when you're 40, and then you have not as early as 40. Depends again from people between 40 to 50 to 60. You can keep having issues. That's when your hormonal changes are again happening, and you put on a lot of body weight because there is drop in your metabolism, and the hip again becomes a little wider. There's a lot of deposit of fat in that area, predisposing you to heart and heart issues. And then you also see that as women get into their 40s 50s, they're getting diabetic because of poor diet, poor control over exercise or a poor rhythm of exercise, bad rest, mood swings, and of course the body fat composition changes.
Right.
And also there's low estrogen during menopause or during premenopause. That's exactly what is causing all these issues. But if you're aware of it, and if you can really take care of that, then the first thing I feel is just awareness. Be aware of it, cater to something, acknowledge that it is happening, and then do something. So those were the
That was,
phases.
yes, so that was like very well explained, covering all the stages of a woman's life. So, Dr. tell me now, how frequently should one exercise?
See, ideally, we say that if you have to exercise for a good, healthy, fit body, all 5 days a week, minimum 30 minutes. Okay, that is what they say. 150 minutes per week is what they're looking at, to keep a healthy and fit body, or at least 75 minutes, which means thrice a week, 45 minutes, or things like that. But ideally, for me, since I have been in this practice for such a long time, I have seen that working out 5 days a week is of tremendous benefits, because as our responsibilities increase as women, it is so important for us to actually get those endorphins in some natural form on every single day basis. So I would, so to my patients, I look at the goals. What is it that you're actually exactly wanting to achieve? So it goes person to person, but a general norm: 3 times a week if you can do cardio, and twice a week of strength training, you're good to go. And definitely include that 1 day of rest if you're doing high intensity.
What is core, and how do you strengthen core?
Right. So the core, as you see, even the word explains it all. So basically, core is very, it is the integral or the powerhouse or the center of our body. It's between this to here. I'll just show it in the picture. Anything from here to here is your core. So anything from your abdominal muscles, the abdomen, the pelvic floor, the entire abdominal cavity, and then your pelvic floor, the inner thigh muscles, the low back muscles, and the fascia. So a lot of people mistaken core as only the belly. So that is not the only core. The entire area from here to here is the core, and everything is connected by fascia. So it is important when you're working out the core, you understand what is the meaning of core, and you work from there. And activating the core is one of the most important part of exercising, or strengthening, because that is your powerhouse in the body. So even if you're doing a move like, say, you're playing shuttlecock, or you're just cleaning and dusting, so the first activation comes from your core. Even if the movement you feel is happening in the hand, the activation is happening from your core. So it's that much more important to activate the core muscles and strengthen them. I've just given you a very brief, very short explanation of what is core.
So, also, doctor, these days we are hearing a lot about cupping therapy. So, what is this cupping therapy, and how different it is from physiotherapy?
See, cupping therapy is a is just a part of physiotherapy. I mean, it's not even a part; it's more of a, you can say, a small aspect of physiotherapy. Now, physiotherapy is basically a paramedical science. It's a form of, it's a part of science, or a branch of science, that helps in taking care of so many genres of things. Like, if it helps you take care of your physical health and fitness, it also deals with mental health and fitness, and anything to do with rehab. And if you're looking at rehabilitating as in post-injury, pre-injury, basically trying to heal the physical aspect or the mental aspect of your body without giving medication. Everything comes under physiotherapy. Whereas cupping is a very small part of physiotherapy. In fact, it's an alternative medicine again, cupping, where you create a vacuum like pressure to increase blood supply in that area. Basically, it's a type of therapy where a lot of Chinese used to use it, and they used to believe in the yin and yang energies. To balance those energies, they used to say the negative and the positive within the body, restoring balance between them, and then increasing the resistance of the pathogens, increasing blood supply, things like that, for which you can use cupping. Now, cupping is nothing but you use cups. There are three, four types of cupping. You have glass cupping, you have plastic, and then you have so many other type of cup. You have fire cupping, where a vacuum was initially being made with fire, but now you have rubber tubes with which are more safer, where you do cupping. It's nothing but just a negative pressure being created to increase mobility in the fascia and to reduce pain. And of course, hijama is also one part of cupping, where you make small incisions and and it's also for cleansing is what they believe. Whereas cupping therapy is just to relieve pain and increase the blood supply and reduce your spasms. That's one of the main reasons why we use cupping, apart from general health.
All right. Okay. So, doctor, please share a few tips for all the women out there watching uh, related to their physical fitness, especially for those women who do not have the time to go to a gym. Please share a few tips.
Right. See, you don't have to go to the gym. You don't have to do anything to really be physically fit. Just put on the shoes, learn how to do some warm ups. Go ahead, go walk. Go walk in your colony. If you cannot, you just have the room, you can even walk there. There were times when there was COVID, we were not supposed to go out. We used to walk in one single room, it was fine. But be physically active. If you want to talk over the phone, take the phone, walk around and talk. All right, you want to SMS, talk around, walk around and do it. Or there's so many ways. If you're cooking, like while you're cooking, you stand for so long. Take a small stool, take one leg up and keep the leg up while you do the other. There's so many videos that are there right now on YouTube, and where you can actually look at home exercises that you would might want to follow. But if you're a person who's been having back pain, knee pain, diastasis recti, any other issues, neck pain, shoulder pain, fractures, please make sure that you actually at least once get either an online consult in these places. Some places help, but then a physical consult at least before you start off an exercise, or speak to your physician before starting off an exercise, or simply just go for a walk. Make sure you at least walk for those 30 minutes. But while you walk, I want you to keep in mind there is a basic warm up, there is an exercise period, and a cool down period. Now, why do many people not like walking? Like, including my mom, sometimes when I used to push her to walk, she's like, no, then I get a lot of cramps in my leg, which is a typical, behavior where you're saying you're not having enough warm up and a cool down. You just have to stretch your lower legs, stretch your entire body, or go for a 5-10 minutes of a slow walk. Then you have a brisk walking period. Then again a cool down period. Now, as you cool down, you also again need to stretch, let that release happen, let the lactic acid come out, and all the other things rest down in your body, and then close your exercise session. And again, while you're taking care of your children, you can exercise. I mean, you give me any scenario and I can come up with an exercise, literally. So give yourself that half an hour, give yourself that 40 minutes of being away, being alone. Or if you're not the kind of person who just likes to be alone, be in a community, go in a group, or whatever kind of, helps you. Don't let go of the natural phenomenon that is there in your body, the endorphins. Endorphins, the name itself says endogenous plus morphins, which is a natural relief of morphine-like, thing that is happening inside your body. Morphine is an external drug. You have that inside you. Why would you let it go wasted? Just enjoy having more and more of it. So that's that.
It was wonderful, wonderful talking to you. Thank you, Dr. Fiza, for
Thank
taking
you.
out the time and doing this session and sharing such useful and valuable information with us. Thanks a lot.
Thank you so much for having me over, and thank you for giving me this opportunity, Hannah.
Thank you, everyone, for watching us. Stay healthy, stay happy.
And don't stop exercising. Use
Don't
those
stop
endorphins in your
exercising.
body.
Yes, yes, that is the
Take
most
care. Bye
important.
bye.